Hello everyone, and welcome to my Module 6 presentation on Down syndrome by Kelly Campbell. Down syndrome is a genetic disorder caused when abnormal cell division results in an extra, full, or partial copy of chromosome 21. This extra genetic material causes the developmental changes and physical features of Down syndrome. Did you know in every 700 live births, there is a child born with Down syndrome? Down syndrome is the second largest genetic cause of intellectual disabilities that are present in all people with Down syndrome, but they range from mild to severe. There are several physical characteristics that are present in a person that has Down syndrome. We have short stature, club short fingers, epicanthal folds, which is the skin at the inner corner of each of the eyes, which makes the eye look like it's slanted. We have flat occipital lobe, which is the back section of the head. They have speckled iris, malformed ears, flat nose, upward tilt to the nostrils, and then the most dominant would be the lobe muscle tone. There are several areas of concern for a person that has Down syndrome that can range from mild to severe. They can be born with heart defects. There is a higher possibility of hearing or visual impairments. Their average life expectancy is 55 years old, but it is common to reach their 60s or even their 70s. Then we have motor, language, speech, and cognitive development that are also impacted. Here are some tips for parents. Being a parent of a child with Down syndrome, you are more influential in your child's development than their teacher or therapist. Early developmental learning occurs throughout their day. Tip 1 is to learn the facts. Do your own research, as there is a lot of misinformation or outdated information about Down syndrome. Knowing facts is crucial for making decisions and maintaining a positive and realistic attitude. Number 2 is to stay organized. Children with Down syndrome will visit medical specialists, teachers, therapists, special educators, and other professionals to meet their mild or severe needs. A key to staying organized is to develop a system to keep the information on hand. Here is a quick guide to creating a medical care binder to help stay organized. Tip number 3, your child is still a child. Please remember your child is a child first. Your child has Down syndrome, but that does not define them. Use people first language such as my child with Down syndrome or baby with Down syndrome. Stop seeing your child as a diagnosis. Instead, see them as a child with a particular needs. Go on play dates. Find activities you can do together. Or find programs and activities that are designed for children with special needs. And stay active. Tips for educators. Number 1 is to set goals. Make sure you set attainable goals for each individual's capabilities. Adjust the difficulties levels accordingly and remember that no victory is too small. Celebrate the small wins with a lot of praise. Number 2, believe. As a successful educator, you need to believe in your students' abilities, practice self-compassion, and when you become overwhelmed or stressed, take a pause and remember you are doing your best. Number 3, use visual goals. Children with Down syndrome tend to be strong visual learners. Practice using visual cues, visual cards, include additional images during classroom curriculum, and just make sure to place a strong emphasis on visual demonstrations, pictures, and illustrations when you are giving out lessons or around the classroom. Listed are a few resources for families. The first one is the National Down Syndrome Society, otherwise known as NDSS, which is the leading human rights organization for all individuals with Down syndrome. Next, we have the National Down Syndrome Congress, which is dedicated to improve the world for individuals with Down syndrome. They are the leading national resource of support and information. Lastly, we have the Special Olympics. The Special Olympic is a program for young athletes with developmentally appropriate support for young children with special needs, and also offers an abundance of information and educational workshops for parents. Here is a list of resources for educators. First up, we have the Down Syndrome Information Alliance to help understand the unique learning profile of your student and how you can effectively educate and include them. Next, we have DSE, which works to improve early intervention and education with research, information, and resources, advice, support, and training. Lastly, I wanted to share the National Down Syndrome Society for educators as well. They have printable education resources such as learning profiles, inclusion checklists, and best practices. Thank you for your time. That concludes my presentation on Down syndrome.